Hello everyone, welcome to Medical Education Nepal. Today we are going to discuss one of the most important communicable disease that is still prevalent in our society and in the entire world. That is the COVID-19. I guess you all have been aware about this disease, and since 2019 it has been widespread. It was at its peak during the 2020 and 2021, and currently since we are moving forward to 2023, it's still very much relevant in our day-to-day life and in our society as well. Okay, so let's get started. So today we will cover the introductory part of the COVID-19, its history, its origin, its epidemiological triad, mode of transmission, incubation period, clinical features, and so many other things. Okay, so let's get into the introduction part. So COVID-19 is an infectious disease with the potential to cause acute respiratory infection. So since we all know that it's an infectious disease, it can be transmitted from one person to another person. We can also categorize this as an communicable disease, and basically it's affect mostly our the acute respiratory tract, the upper respiratory tract, and uh, since it is caused by the SARS-CoV-2, that is also known as the novel coronavirus. So this SARS-CoV-2 is not a new thing. It has been previously also been discovered by the scientists. SARS-CoV-2 are basically the RNA viruses that belongs to the family Coronaviridae. The other examples of these viruses are the SARS outbreak in 2003. It was also caused by the SARS-CoV variant viruses, and the MERS 2022, that is the Middle East Respiratory Syndrome, was also caused by the same type of the virus. Now, looking forward to the history of the COVID-19, in December 2019, some unknown outbreak of pneumonia-like symptoms was occurred among the people of the Yuan city in the Hubei province in China, and it quickly, like not slowly, but it quickly spread. First of all, the entire Yuan city, then to the Hubei province, and to the China, and especially the entire world. So, in on 11th February 2022, the World Health Organization named this unknown disease as COVID-19, which means the coronavirus originated in December 19. And on 11th March 2020, the WHO declared COVID-19 to be a pandemic. So, now what is a pandemic? Pandemic means the virus. This virus has been spread to the entire world, and now it is one of the most important diseases to be notified. So this is known as the pandemic for the world. Now the first COVID-19 case was in case of Bangladesh. It was reported on 8th March 2020. Now this is a photograph of the Yuan city during the lockdown. As you can see here, some health workers are like cleaning the city, and the city is in the completely lockdown phase. Now, the origin. Many health experts believe that the new strain of the coronavirus is likely to be originated from the bats or pangolins. However, the first transmission to human was in China. So there are lots of theories about the origin. One of the theory is that it has been most likely to be originated from an animal, like most probably the bat or the pangolin, and there are some other theories as well. We will look forward to that. This is the image of the Yuan city market, where it was believed to be spread started from here. Now, okay, this is a photograph of the Yuan Institute of Virology. There is also some conspiracy theory, like the virus might be a result of an accidental breakdown from the Yuan lab, this Yuan Institute of Virology lab, and not from originated from any animal or the bats, as you say. Now, looking forward to the epidemiological triad, it's composed of environment, agent, and host. The agent we have already known, the SARS-CoV-2. The hosts are the humans, and the environment, currently there is no specific data regarding this, and the research is still going on. Now, talking about the host, the humans, looking forward to their factors, the age, it affects all age group, older and people are much at a higher risk because of their lack of immune uh, strong. Their immune systems are particularly weak as compared to the adult people. Now, immunity is another factor. Immunosuppressed people are more vulnerable to COVID-19. Infection to COVID-19 may or may not provide immunity to this disease, as a case of reinfection has also been reported. So it means that even after you get an COVID-19 and you recover from that, there are still chances that the reinfection may still occur to you. So smokers are also more prone to COVID-19, as we all, as I have said that in the earlier slides, that it affects the upper respiratory tract, and smoking is also related to the upper respiratory tract. Now, previous lung disease are also a factor, important factor. Now, the mode of transmission. So here we can see, and there is an image of a young boy with infected with the COVID-19. He either talks or he coughs or he sneezes. What happens here is the virus droplets comes out during his talking or his coughing or his sneezing, and this virus droplets, particularly known as the respiratory droplets. You can see the image over here is somewhat like this in the micro image, and this respiratory droplet, it either goes into the air or it falls on the ground or onto the surfaces. Now these surfaces are known as the fomite surfaces, and in the air it stays up to for 3 hours. Now the fomite surfaces are those surfaces like where the respiratory droplets sit down, and it depends upon different kind of surfaces, like how long they will stay there. Okay. Now this respiratory droplet goes into a healthy person through three sources, and those three sources are either your eyes or your nose or your mouth. So it is, you can see over here in the picture. So do not touch your eyes, do not touch your nose, or do not touch your mouth, because this can be a way of transmission of the COVID-19. So, in summary, mode of transmission is the droplet infection, physical contact with the infected person, the fecal-oral route. Okay, this is an interesting thing. Uh, the can see over here, the virus was also found in patient stool, so it suggests that the virus can also be transmitted through fecal-oral route as well as through water pipes. So apart from those three sources, there also have been those three routes. There also have been found another route, that is the fecal-oral route, and it suggests that virus can be transmitted through this route, and it also gives evidence that since fecal-oral route it can be transmitted, then it might be also present in our water pipes. Okay, the virus can be transmitted even before the symptoms appears or even when no symptoms appears. Now the incubation period is on average is the 14 days, and the virus will still be transmitted during this period. Now the clinical features, the common symptoms, the uncommon symptoms, and the complications that may arise for the COVID-19. So fever, dry cough, shortness of breath, fatigue. These are the most common symptoms. Uncommon are the headache, diarrhea, confusion, and the complication that will raise is the ARDS, acute respiratory distress syndrome, secondary infection, some septic shock, acute renal injury. These are clinical features. Now, talking about the variants of the COVID-19, there are lots of variants of the COVID-19, but the most popular ones are given over here: the Omicron, the Delta, the Alpha, and the Beta. So, this is not that much important to know, but just for curiosity, you can know these things. Now, the prevention, management, and treatment. So, how can you prevent COVID-19? You, first of all, you must use a mask. Now, lots of people say that mask is not effective, but in particularly, I believe that mask is really, really necessary. It's very much effective. Somewhat, it's very much effective to prevent the COVID-19. Yes, we do need the proper PPE suit, but masks, if we don't have that proper PPE suit, masks can also be used. Okay, so maintain a safe distance, and then do not touch your face, clean the surfaces, cover your mouth, wash your hands regularly, eat healthy, stay at home, do some exercise. These are the things. Now, home quarantine, if you have been infected, you must do the home quarantine, or you have come in contact with someone infected person, you have to do the quarantine or self-isolation. Now, some of the vaccines that are available, we can see over here, Pfizer, BioNTech, Moderna, Novavax, Sinopharm, Covishield, Johnson and Johnson. Okay, so this is the photograph of the Sinopharm COVID-19 vaccine. This vaccine I have taken two doses through my college. Okay, now, talking about PPE, what is PPE? So, PPE is the personal protective equipment. This I hope you guys are very much familiar with this suit. You can see in all of the lots of the hospitals, even in private clinics and chambers. Lots of doctors have been using this PPE during the COVID time, and still lots of people, lots of doctors use this shield. So it consists of goggles, mask, overall gown, face shield, head covers, gloves, suit covers, and all that. So why it is important? Now I have included this slide because I guess this is one of the most effective way to prevent the COVID-19, and why? Because it minimizes the spread of infection from one person to another. um, the eyes from the infectants present in the air. It protects the lungs from breathing in the contaminated air, and also the skin from contact with the corrosive materials. So now talking about the global death and case and death as of 26th September 2022, the total case in case of the world is 650 million, death is 6.54 million. In case of Bangladesh, it was total case is 2.02 million, and death is 29,353. In case of Nepal, it's 1 million, and death is 12,017. So that was all about today's COVID-19 lecture. So stay safe, stay healthy. Thank you.